I just don't like it. Oh, I think it's Susie. My final word, I think it's Susie, right?
I'm here.
I thought that was you.
Can you hear me? Can you hear me?
Yes.
Okay.
So why didn't you not hear us?
I think she heard me.
Yeah, because you're in front of a mic probably. Yeah, good.
Like in a late summer.
Okay.
Almost didn't flood away yet.
Starting to,
Started to.
yeah. Good morning. Yeah, that river's really going.
Pictures that on Facebook there, like.
Yeah, yeah.
And then Sarah, town clerk, she hiking down the park. She showed pictures of it on the east side, where how wide the river was down there.
I went hiking too on Monday down there, and it was wrong.
Yeah.
It was cold, like holy. I do it quite a bit, so I know the difference. And,
Where do you hike?
we hike all over. One day we went up around where the new train trestle was, you know, where the train trestle was, there's a path that goes out.
Yeah, it's nice Monday. There's a lot of people there Monday.
You got Susie and you got Sammy King.
You see it?
Yep.
Okay. Well, I guess I'll call this public health committee meeting to order. At 9. So first on the agenda, Kelly, you're up. Looks like we got a proclamation.
Just Developmental Disabilities Month, so acknowledging that, and Glow Art is asked to come in person to accept the proclamation.
Thank you, Lee. A motion by Supervisor Roberts. Is there any discussion? All in favor? Aye. Opposed? Carried. Item 2, Wolcott Farms.
So we have there's two contracts that we're working for Dwyer Veterans Funding. First one is for Wolcott Farms to do instructional horseback riding. It will be, he has it set up to go the third and first and third Fridays of the month. Up to 10 veterans can go. It's $100 per veteran. And they can be there from, it's a big block of time, like 5 hours. And they'll work with, getting to know the horses, and then, as they're more comfortable, there'll be some horseback riding and things. But Tony, it'll be him and Robin, either one of them will be there with the veterans. So
I know it's a good program. My brother-in-law had a practice. And it helps him.
Is there any liability to it,
So yeah, I think the contract that we created covers that in there. Wolcott Farms has a liability form that they fill out, and then we're working on one for just any Dwyer veteran peer-to-peer program, like a participant agreement that, yes, covers the liability piece.
Okay, we want to do number 2 also then. Both Dwyer.
In the second, so the number 3, the third one. Is also a Dwyer contract. So this one's a little different. This is with Maine Encounters, which is another, this one has, it's equine assisted learning and psychotherapy. So this is more specific. They're looking at the psychotherapy piece. It's 8 sessions, depending on what, there's 4 different levels of service, but the individual would go for 8 sessions. And they would work with the horse or a mini donkey and the therapist on, whatever, trauma stuff that's going on there for them. So these individuals would be identified by Tony as needing this level of service. So this one is not to exceed $15,000.
I'm in it.
I got a motion by Supervisor Roach for 2 minutes free. Is there any further discussion? All in favor? Opposed?
Aye.
Did have a question on that. So you saw the email about them giving us too much money.
No, I should not.
I just wondered about that because
No, when did that? I have not seen that.
they sent us an email with a big red exclamation point. We accidentally gave you too much money. And we're gonna be taking it back. So I don't know, I gotta look into that.
Okay.
After, so I just assumed you guys had it, because you guys are charging.
When did it come?
The end of last week.
I saw them on Friday and yesterday, so I was
Okay, so maybe,
but I did, so I didn't get it.
so maybe I'll double check it and I remember looking at it, and go, oh,
Okay.
but I don't know if it was the allocation or they just gave us too much money and those. It seemed like we got a lot of money all of a sudden,
Yeah,
but
but they haven't given it regularly, so,
Yeah.
okay.
okay, let's take a look.
Yeah, we'll check into that. So what are we, okay.
Yeah,
Keep going.
yeah.
Okay, item 4 is an appropriation for state aid adjustment.
Yeah, so we had 4, 5, and 6 are all appropriations, just based on what we had appropriated in the original budget, and then what our state aid amounts ended up being. We just had to shift money around to make sure we're paying out each of those line items correctly with the new system.
Just kind of.
Yeah.
Okay, I have a motion by Supervisor Doctor. Is there any discussion? All in favor?
Aye.
Opposed? Motion carries. Item 7.
Yep, 7 and 8 go together. We were notified by OPWDD that they increased state aid a little bit for the funding for SASE suburban adult services, an amount of $652. So we needed to amend their contract up to, it'll be $41,464,000. And then number 8 is the appropriation of that monies.
So why is it just in the southwestern part of Lebanon County?
Well, I guess anybody could use that, but that's where SASE is located in Elma.
Oh,
So they just cover like that arcade, Chafee area is their service
but
coverage.
anybody in the county might be eligible.
If they wanted to, if they were able to get there, yeah, and get to their services, they could utilize those services. So they do, the community pre-vote services. An individual can get that from the ARC as well, and the ARC covers the whole county as well.
I'll move. 7 and 8, live with together.
Okay, motion by Supervisor Brick for item 7 and 8. Is there any further discussion? All in favor? Opposed?
Aye. Aye.
Resolution carries. Item 9, another appropriation.
So number 9, but this was correct as of Friday.
It probably still is. We'll talk later.
This was the appropriation that we didn't, we weren't sure because Dwyer carries over from year to year, so we had only appropriated 40,000 in the budget. This was the remaining based on the state aid that they had given us to appropriate the full amount. So go with it as it is for now.
More to come next month if it's
Yes,
not
yeah.
right. Okay. Motion. Motion by Supervisor Grant. Any further discussion?
I have a question. So you were expecting to get the money back for this appropriation?
No, we don't know. I guess I don't understand your question.
It's a grant, so.
It's already a grant money.
This is grant money, so
Okay.
we won't spend it if they don't get it.
Yeah.
So we'll just double check and make sure.
It's
that they're,
amount that we're
yes.
Okay.
Yeah.
Thank you.
I won't let them spend it.
Yeah, no, we
Yes.
And we'll keep track of, I mean, it's,
Yeah.
you know, but we keep track of all the, you know, make sure that they don't go over, so.
Basically, there's quite a few grants in budget. When we do the budget in August or September, you know, we're working on that, have to stop somewhere and actually have it a line drawn so we know what we're doing.
Yeah.
They still are spending out the grant, so they don't know that number for next year because some grants run for 2 years or whatever, so they guess. And then a lot of times we shore it up in the next year. A lot of times we do that with Homeland Security anyways, like we'll say, okay, we spent less than we thought, so we're gonna add more to the budget for 2022.
Okay.
This was a lot, and there was just some correspondence, so it was done.
Thank you.
Any other question? Hearing none, all in favor?
Bye.
Opposed?
Aye.
Resolution carries. Want to go on travel?
This is our conference of local and hygiene directors, so a spring membership meeting, it'll be in Saratoga Springs in April. And I would like to attend.
Motion by Supervisor Rowe. Any discussion? All in favor? Opposed? Carries. And an FYI.
Two FYI conference, the first one is for students, veterans lawyer is going to go to a Buffalo Sabres game on March 30th. So they purchased the tickets and then this is the bus travel for it. And then the second item is have the carpets cleaned with the mental health department. And so that is to cover that carpet cleaning.
Anyone have any questions for Kelly? Anything further for us?
No, I don't think so. I don't know if anybody has questions on services.
I will be bringing up a plan, this afternoon about possibly finding some space for mental health. Based on the condition of the building down there, the layout, really doesn't lend itself well to an office setting. And mental health services have come to the forefront in the last few years. Where I think we need to have a little better office space for them. So I'm gonna bring it up to planning to see if there's.
Jerry, that office space has to be the worst of it.
Well, Kelly, you can answer that.
I mean, I think it's ideal, you know, just with the seat, but
No, just if you can't find any place. Here.
in my home place.
Are there any places the bus doesn't go? Like people can't get there?
We we don't have a lot of traffic because we are just in administration, so I mean, that isn't, I don't think a huge priority to make sure we're on those lines, so. It's just our staff.
But we'll discuss it in planning. We'll keep our.
Dangle that tree out there like you're onto something, but you won't tell.
Wow.
Good, yes, I'm looking forward to.
Dangle that carrot out there.
You have to come to planning.
Yeah.
I just thought I would throw it all over the planning committee. Keep their eyes open. A suitable place. Actually, I'm not sure how much square footage you really need. Did Mike ever, Mike had there come up with a kind of a figure for it?
I don't know if I
And
don't know
that's-
how it's.
that's something-
Yeah, no.
You know, that would be one of the first things we need to find is how much square footage. you need.
I almost think that there is a square footage for that building. From what you guys do to it.
So. More to come, I guess.
I feel like I don't have a question.
Next time.
I just wanted to acknowledge
Kelly's assistant for social services. And the past month or 2 months, with assisting them finding a placement for one of their young individuals who, you know, is in a bad situation. I know it's not totally resolved.
No,
It's not a permanent.
I think we all, the
It was
systems
a
work
big
together.
relief to everybody working together. Very good.
Is there a lease on that for a certain amount of time period?
Here, we just entered a new lease for 5 years, but it does have it written into it that it will be a 30 or 90-day notice that we could break it. So. Nice, I mean, we're content to be there until we find the correct place, but if we don't ever look, we won't ever find the correct place.
Yeah, it's not something that's urgent.
I think the initial lease on that was like 10 years, and that covered the purchase price of that building. So when Jim Latowski bought it, he's gotten his investment back.
Yeah, he's got it.
Yeah.
More, but again, it's not something we're gonna run out, try to find a place tomorrow. So, jump in our lap, we try to consider it. Anything else, Kelly? Okay. Thank you, Kelly. Well, Doc, I guess you're gonna be next up.
I am.
And Carolina, so
Let's do it last.
it's last,
Let's do it last.
okay, because I don't.
Okay.
All right,
And I'm sure Dr. Collins is aware, once we start talking about it.
okay. Well, item number 1 is an appropriation.
Yes, I'll have Jess speak to that if anybody has any particular questions on it.
This is just to appropriate the funds for the ELC school grant that we received. We received it after budget, so now we just need to appropriate the 2022 portion.
Fair amount of money.
It was, yeah, it's a considerable, you know.
Sure.
I have a motion by Supervisor Becker. Is there any discussion? All in favor? Opposed? It is carried. Now, professional service contract with Ontario County.
Yeah, this is the Ontario County had available a large number of test kits for COVID that they made available to the region through the Finger Lakes. Becky's aware of that she had some of those calls. So we elected to, using the COVID school grant money, purchase 20,000 kits, or sorry, $20,000 worth of kits from them. So we had those available for us.
I have a motion by Supervisor Brick. Is there any discussion?
Is anybody got those free ones from the government yet?
No.
Okay,
I haven't heard of
The
that.
letter came in the mail, my daughter said. The letter came in the mail that she should be getting it within a week or so. Whatever
They
that
sent
is.
out a letter for that?
Yeah. They sent a letter out to tell you, they sent you a letter to tell you that you would be getting your kit. Talk about a week journey, right? Yeah, we're not waiting for the letter, we're waiting for the kit, right?
Okay, I have a motion by Supervisor Brick. Is there any further discussion? The test kits. All in favor? Opposed? Carried. Okay, we got some FYIs.
The first one is Spectrum care coordination, and that is no cost agreement. Second one is for Arctic refrigeration that service and maintains our vaccine freezers and refrigerators. Third one is for Survey Monkey, which we utilize for different surveys, including our community health assessment. And then the last one is for Deb Farley, who is our hearing officer on a designated basis. Okay.
just loving the name of the street that Survey Monkey is on. One curiosity, right?
You wanna, is this one mounted?
Yeah.
Okay.
Yeah.
I responded to an email that Laura sent yesterday, so I don't think Laura has seen it, but I responded to everyone in it. She said, I'll just read it real quick because it's short. Hello, we received the information on Friday regarding the 2021 lump sum payments. I have the following questions for your consideration. Nicole Caruso is a COVID response assistant on Schedule G. I did not anticipate her eligibility for the 2021 lump sum payment until I learned the following. Nicole has had CSEA union dues withheld since she started and has a CSEA membership card in her possession. Given this anomaly, I am requesting she be eligible for the 2021 lump sum payment. This is grant funded. I have advised her to address her membership status with CSEA and talked at length with John Ford about it. We have budgeted funds available to cover this expense if it is approved. Also, I see that Steve Perkins, who was on Schedule S for the entirety of 2021 and remained an employee as of 1/1/22, was not eligible for 2021 lump sum payment. If this is a deliberate decision, please let me know, as well as the interpretation leading to it. If it is an oversight, please include it as an action item to future salary schedule as amended by the board of supervisors. So this was my response to everyone. Paragraph 1 should be on Laura's agenda. We gave no consideration whatsoever to Schedule G as is customary because of the grant funding. So those always come from the department. Paragraph 2, Steve will receive a 2021 lump sum payment. The salary schedules reflect your currently occupied position. So Steve's calculation will take place, but not on the salary schedule, as there's no one with this type of legacy information. I hope this properly addresses. Okay.
And then, so with that, I know Dan responded, it's like yesterday afternoon.
Yeah, something about her membership, because the position that she currently holds on Schedule S, the COVID response assistant, is not a union represented position. So she should ask for her membership to be revoked.
So as far as Nicole goes then, so that she would not be included with the lump sum because she, or would be.
So she can be at Laura's request, because for several reasons. Anybody on Schedule G, we don't address them. The board of supervisors, they leave that completely up to the departments because they're the only ones that will know if there's grant funding to cover that, right? So in Laura's case, she's advocating that she receive it because it can be covered with grant funds.
Yes.
And I don't think anybody really has any objection to that. So we said, go ahead and put it on the agenda so that the committee can address it.
But so, and some of it's covered with our grant funds that we do go.
So we'll just add a block that says amend salary schedule G to reflect the inclusion of this lump sum payment to that particular position. Effective when everybody else is effective.
Wonderful.
Yeah.
Very good. Good. I appreciate all the work that went into all of that. You know, Laura does it about.
It's what we do, yeah.
So good. Okay.
So we have to take action.
We do. We have to add a block, either before or after his operational update to amend the salary schedule.
Why don't we hit the block right now?
Okay.
Everybody understand what's going on?
Do you have a dollar amount?
I don't yet, no. I didn't even look at it. Wait till 7 o'clock this.
Can I add something right now as well? A walk-in type of item. We are asking to be included into a grant with the planning department to pay for part of a training that one of our fellows receives through that department.
Yeah, so what you're actually, because I had this conversation, you're actually, I don't have the number off the top of my head, but Janice and I had a conversation via email, and it's amended resolution number, I don't know, to include public health.
Right.
And to segregate out certain pieces, which You guys are gonna have to just take a leap of faith and vote, yeah, they're doing it, we'll make it right in the minutes. Because I think you need it soon.
Yeah, to be able to pay that portion of the training for her.
So what we're talking about is the contract with ESRI, and if you remember, this was the real property tax services, contract that came through for GIS
Conversion.
and some GIS conversion training. And part of it was like $6,000, and that was the
That was our
property tax piece.
Ours.
And then there was like $2,200 worth of something that goes to your property, so like between everybody that was involved in the conversation, we just got an amended resolution to include public health. So that that bill can go to both places and everybody gets to pay their own.
So this came up, yeah, so it's not changing the dollar amount, it's just that when I'm speaking with Sarah, she wanted to get the ball rolling, she wanted to get it going, she wanted to do this and just have one contract, and I'm like, okay, that creates problems when we, so because we didn't know, so on our end, and we're sitting in our chair and we get a bill from public health for $6,000 to pay a contractor, and they don't have a contract with them, that's red flag. We're like, wait a minute, you don't even have authority to pay this so that's what brought this up. So it's just a learning thing, it's housekeeping, and
It's not a big deal.
It's not a big
It's gonna be a big deal.
So,
It's just a.
it's
matter of
just
getting
housekeeping.
Right to her.
As involved with that.
Yeah,
She's got two motions, actually.
Yeah.
The amend salary schedule G that we've got to finish. And then Jillian's amends resolution number, I don't know, to include them with the ESRI contract.
it was approved last board.
It was, yeah.
Who wants to make a motion that understands what's going on? Ellen is gonna make the motion.
Come on, I'm schedule.
Okay. By Supervisor Grant on Schedule G. Any further discussion? All in favor? Opposed? Now,
Come on, you guys, we're like right out of Riley over here, we never steered you wrong.
okay. Now we're gonna do what Jillian has brought in.
The resolution.
Amend the resolution.
To add public health with the contract,
This is no dollar change.
no dollar change. It's
I'll
just,
move that.
Not spending any money.
Okay.
All right, I have a motion by Supervisor Roberts. Is there any further discussion? All in favor? Opposed? Carried. Okay, Doc, I think you're ready for operational updates.
Excellent. All righty. So the first thing on the list is the COVID-19 response update. I think our percentage positive now is down around 2 or 3%, which would seem reasonable that we can drop out significantly. Things have opened up quite a bit there, so that's good. We're continuing our weekly boosting clinics. We're currently still doing 2 testing clinics a week. The numbers there have dropped off significantly, so we're probably going to be stopping that and bringing it back into the department and running the testing out of the department. For example, we've got one set up to go and 6 people signed up for it, so highway, so we're going to talk about that this afternoon or later this morning when we prepare the meeting. As you know, the booster mandate was stayed for 90 days, which was a big help for the health system as well as our department. We had a couple of staff that had boosters as well. So that was good news on that piece. New York State budget proposal overview, Jess, can you talk about that briefly?
The two main things is they are proposing an increase in our Article 6 state aid. And the other big piece is they are looking to allow fringe as an allowable expense up to 50%, which would be a giant help. So those are kind of the sticking points that we're have our fingers crossed for.
Yeah, actually some positive news for us in the state budget for a change. If it comes to pass.
Yes. Hopefully it holds.
Sure.
And then we're starting our community health assessment, community health improvement plan process again, which we do, I think it's every 5 years or so. Jillian's for 3 years. Jillian's spearheading that for us, and I got a couple comments on that.
Sure. So we're just starting to distribute our surveys in the community, and what those surveys do is allow the residents to have input on the status of their health and what they think the major concerns on the community are regarding health and disparities in services. So we're going to be launching a link for SurveyMonkey for respondents to get collected, to gather data and see what those disparities are. And then we'll write a community health improvement plan in which we focus on those areas to improve the health status of the residents. We work with Genesee and Orleans counties and their hospitals to submit the plan as a tri-county region. So what we're asking is when we launch the survey, if you could disseminate it to your listservs, to your service providers, to community members, family members, and complete it yourself. So we can get the greatest responses back to see what those disparities are that our community members think to write our plan. So once we launch the link, if you could just complete the survey, pass it on, so we can get those responses back. We have to have at least 1% of our community respond to the survey, so that's about 450 people. So we're hoping now with social media, we have a great following through the health department that will be able to achieve that, but we're also looking for your help as well.
You're only doing this on this link?
So we'll have paper copies available throughout the community, libraries, social services, community-based partners that have clientele that walk in to receive their services. And then also if anybody would like a paper copy, we have a department for distribution.
I'm just thinking your senior citizens really aren't gonna get online and fill out a survey.
So actually we have a plan for the Office for the Aging. We're gonna send our plan out on the Meals on Wheels program to get those responses back.
That's a great idea.
We also do community conversations. Once we receive the preliminary results back, we'll focus on areas that we're lacking respondents on. So last time we were lacking men, so we went to fire departments and had community conversations to get their input. We also did the congregate meal sites last time to get the senior citizen population as well. So we do target areas that we're not getting more responses.
Do you have any questions for Joe? Okay.
Next is our Board of Health meeting, which we had last week on the 16th, primarily focused on 2 issues with tobacco sales. I'll let Rob comment on that.
Sure, we can wrap that in with the environmental health report, but we did have our hearing officer supplied recommendations for the 2 cases of tobacco sales. And the Board of Health to get their final determination. They agreed with the hearing officer's decision and found against the facilities. So I will be writing letters to facilities and let them know of the actions that have to take place. One of the facilities will be second time sale, which carries a little more gravity to it, potential loss of license and that sort of thing. So again, we'll be in contact with the facilities, let them know and go from there. But any questions on that, first of all?
I will say that the Board of Health spent a significant amount of time really digging into this.
Yeah.
Because these sales have such implications for local businesses. They really spent a lot of time doing their due diligence, going through the cases and what happened in particular, and did end up agreeing with the hearing officer that there was a violation in both cases.
We did also hold a tobacco sales training course at the office. Actually, it was at the government center, I should say. Open that up to any retail facility in the county where they could send employees in for training on, identifying underage people and preventing sales in the future. We're gonna try to do that twice a year so that facilities can rotate their employees through and not send everybody all at the same time. But that was reasonably well attended. Again, we'd like to see more people, but we will open that up every year. And the other item I know, we had a kind of a strange one. We had a person hit a coyote on a snowmobile and decided he wanted to keep the coyote. Unfortunately, the coyote was not killed, so it latched onto his arm and bit him pretty severely. So DEC did get involved. They were notified. Officer Hunt contacted our office to arrange for testing of the animal. We did send it for testing. It was negative, thankfully. But it was kind of odd because it was on a snowmobile trail, kind of in the Yorkshire Arcade area. Some conversation as to whose county is the thing even in. So it was settled on that it was one of the county's animals, so we shipped it for testing. Again, fortunately, it was negative. So I guess be careful on your snowmobile. You never know what's gonna come out in front of you. And,
Well, what did the guy do after it bit him?
took pictures of it latched onto his arm.
What?
With his free hand.
Not kidding.
That's a great picture.
I'm sure.
That's a great picture. I'm sure that would be buddy.
Got his free though.
Was there alcohol?
I could not say.
We might have got it through the blood transfusion.
So, but other than that, fairly quiet. A couple other animals that were sent in for testing, so.
Anything on the weights and measures side?
Just, we continue to pick away at our devices. Ryan Hamilton did a outstanding job for the month, getting out and doing a number of the small assay scales, like the deli scales and register scales that supermarkets have. I think he did 72 of them in a month, so it was great on them, very efficient, so very pleased with that.
I just want to add, and I think you probably know, Mike probably knows, but Rob reported on the task force meeting that we had last week that with the mask mandate and the concern with businesses and everything, there were
13 complaints on our hotline for the complaint period during the mask mandate. We did reach out to each and every one of them. Jillian actually assisted with that, make sure that happened, but no enforcement actions were necessary. You know, we spoke to the owners, let them know what the requirements were, and they seem to be responsive. So we're pleased with that. But I was surprised at the low number. I thought there would be a lot more.
Yeah.
So that was fortunate.
That's good news too.
Absolutely.
Thank you very much.
Okay. We got anything else?
I don't have anything else.
Does anybody got anything for the health department?
All right, thank you.
Thank you. Is there anything else to come for public health? We were adjourned.
Yeah.
That's right.
So much for that, huh? There you go.